And we said we'd talk about these branches. Okay, so let's go back to the roots just for a minute. To review, what neurons travel in the posterior root? Would these be sensory or motor, or are they both? Remember, the posterior root has a ganglion, and this ganglion is for those neuron cell bodies, right? A ganglion is a collection of neuron cell bodies. So when we look at the structure of the neuron, then you can kind of figure this out. We know that the neurons that look like this, right, where they have their cell body kind of in the middle, these are the cell bodies that are going to be in that ganglion. And then the axon will come into the spinal cord. Okay, so this would be the spinal cord, and this would be somewhere out in the body is where this neuron begins. But the cell body is going to be in this ganglion, which is called the posterior root ganglion. And so is this type of neuron, is this a sensory or a motor? Sensory. It's a sensory, right. So you can figure it out if you just, think about that. So the posterior root carries only sensory neurons. There is actually a mnemonic for this, and I forgot to give you this last time. It spells the word amps, or if you like this better, we're kind of used to hearing the word spam these days. So you can use either. So this would be anterior is motor, posterior is sensory. Okay? Or either way. Sensory in the posterior, anterior is motor. I don't know. Whichever you like, or you can make up your own. Okay? So posterior is sensory. Anterior is motor. Okay, and again, this is one of those things that seems very simple, but as you guys know, you have a lot of detail to remember, so it's one of those things that's easy to get, kind of mixed up. So this is going to be, again, in the anterior root, we have motor neurons. Where would their cell bodies be? First of all, what type of neuron is it? Multipolar, unipolar, or bipolar? Multipolar. So we have to put their cell bodies somewhere. There's no ganglion here. So would they be in the white matter? No. Cell bodies are gray matter, right? So most obvious place, I think, is in the anterior horn. And that's exactly where they go. The anterior horn of the gray matter. So this is our multipolar motor neuron cell body, and the axon travels out on the anterior root, and then we have the two roots coming together here to form the spinal nerve. So here is our motor neuron. Okay, this is its axon, of course, but these are all motor, and this would be sensory. Okay, so here's our sensory, oops, forgot the cell body. Okay, so here's our sensory neuron, here's its cell body, there's the axon coming in. It's going to come into this part of the spinal cord, the posterior horn. Okay? So this would be entirely sensory only. And these are, in the anterior, would be motor neurons only. Okay, so let's talk about these branches. These are actually called rami. Ramus is singular. This means just branch of the spinal nerve. Rami is plural. Okay, so we have these different branches or rami, and we will talk about what those carry, where they're going to go. Do you guys have any questions before we go on? Okay. And coming up is stuff that you can skip over. We said that we're not going to cover any of these projection tracks in the spinal cord, so this is actually showing different projection tracks. This is from chapter 17. We are skipping all of this, so I just wanted to point that out to you. You'll see a lot of these slides because there were a lot of tracks in your PowerPoint, and this is just showing this whole pathway, carrying the information up to the brain. So one thing I wanted just to mention to you here, because this is actually reviewed, this is stuff that you guys need to know. So notice again, this is just showing how sensory information eventually goes up to our sensory cortex. But notice that this is a unipolar neuron. It has its cell body here in the posterior root ganglion. Okay, So the axon comes into the spinal cord. Now it's going to travel on one of these projection tracks, which we did not talk about, so don't worry about that. But notice that there's only a couple synapses. There's a neuron that's going to go up through the brainstem, and now notice where that neuron is going. This is the thalamus. Does that make sense that the sensory information is going to the thalamus? Yes, it does, because remember, the thalamus receives all sensory information except for smell, sorts it out, and then sends it up to the cortex. So now we have a third neuron going from the thalamus to the primary somatosensory cortex. So remember, we said this is the area of the brain, the cortex, that receives most of the sensory information from the body, except for our special senses. Okay, so notice this is stuff that we've already talked about here, so that makes sense. Okay, what we did not talk about is just, you know, the tract that carries it up through the spinal cord, so that's the only thing that we're leaving out here. Okay? Okay, so again, this is just information that we are not covering, so skip over it. Another thing I'll just mention here real quick, just so you guys can see some of these areas that we've talked about. This is a section through the midbrain, or mesencephalon. Remember, we said that in the midbrain, on the anterior aspect, we have these peduncles, right? These are called cerebral peduncles. We said that a peduncle is just another name for tract, and this is where projection tracts travel through the midbrain. Notice where these axons are traveling through. They're going through the peduncles. So you can see, you know, in these diagrams showing this whole pathway, some of these areas that we've talked about. Okay, so just wanted to point that out. Okay, again, ignore this. And this is just showing a motor pathway. Notice here that the neuron cell bodies are in the primary motor cortex. Again, axons traveling down through the cerebral peduncles here. Okay, and so we talked about how we have 8 cervical spinal nerves. There are 12 thoracic, right? We kind of went through those. So just to review real quick, these are not named C1 through C8. Then we have the 12 thoracic. There are 5 lumbar, just like the number of the vertebrae. 5 that go down into the sacrum and travel out through the sacral foramina. And then 1 pair of coccygeal spinal nerves. So altogether we have 31 pairs of spinal nerves. This is how they are named. Okay, but I wanted to show you that in most areas, if you notice, like, I know it's hard for you to see this here. If you have your own diagram, you can take a look at this up close, but you can kind of try to look closely at what's happening. You can see this area a little bit better because they're kind of showing them sticking out here. And then down in here, notice that the spinal nerves, looks like as they exit, looks like they get all kind of tangled up with each other. And they're forming a network that is called a plexus. In most levels of the spinal nerves, we have plexuses. Okay, so what they're doing is they're literally coming out from the spinal cord, unraveling, rearranging their axons and forming new nerves. So the plexus itself is this kind of what looks like a tangled, you know, mess, is really an organized rearranging of axons. And they'll form new nerves so that those new nerves carry both sensory and neurons, sensory and motor neurons to a specific part of the body. Okay? So we're going to talk about some of the nerves that come out of these plexuses. But first, let's take a look here in the thoracic region. Notice, if you look closely, it looks like the nerves are just kind of traveling along the ribs, and it doesn't look like there's a plexus there. This is the only area where the spinal nerves do not form a plexus, okay, as T1 through T12. So let's take a look at a spinal nerve and see how they branch. Look at these rami. Okay, and so notice here, you look closely, and you can see this in the last picture we were looking at also. Again, here we have our 2 roots of the spinal nerve. Once they come together, this is right here, the spinal nerve, the actual spinal nerve. Now, pretty much right away, we get this little branch, or ramus, that branches off, and notice it's kind of small in comparison to this other one. This is called the posterior ramus. because it's going to travel back posteriorly, and it's small because this will literally go back to the back, the area here behind the spinal cord. We don't have a lot of body back here because the spinal cord is already, way back there. So this will carry both sensory and motor neurons back to the skin and muscle of the back, okay? This is called just the posterior ramus. Okay, so carries sensory and motor neurons to the back. Okay, so this is mixed, right? Most of our nerves in the body are mixed. Once these two roots of the spinal nerve come together, forming that mixed spinal nerve, carrying both sensory and motor neurons, then these rami that come off of it will also be mixed, okay? The larger anterior ramus is going to come around to the front of the body and supply the anterior trunk as well as the extremities. So these anterior rami are larger because they supply more of the body, okay? And that is what this is. This is the anterior ramus of the spinal nerve. Okay, so supply the anterior trunk and extremities, and it is also mixed. Okay, both sensory and motor. Okay, so now notice we have other rami here. These are actually for the sympathetic neurons, and we're going to talk about that in just a little while. So for now, let's just ignore that, and we'll just focus on the posterior and the anterior. Actually, we've kind of already finished with this posterior ramus because all it's going to do is carry sensory and motor neurons to the back. So we're done with that, okay? The anterior rami are actually what get involved in those plexuses that we were just looking at, okay? And they also travel around along the ribs, supplying the anterior part of the trunk. So now we're just going to focus on the anterior rami, okay? So let's take a look. First of all, and we've already talked about all this stuff, this is about the roots of the spinal nerve. Actually, this is a nice picture because it kind of extends these posterior rami out, so you can see them actually coming back, and you guys recognize this, right? This is showing this whole vertebra. This is the spinous process. So these are muscles of the back. This would be like the erector spinae muscles, okay? So again, we're just ignoring this area right here. Okay, so let's take a look at this picture here. This is in the thoracic region. So these nerves here that are actually called intercostal nerves, you guys know that costal refers to ribs. So this means between the ribs. These are actually the anterior rami of the thoracic spinal nerves. But they are going to travel around along the ribs and supply the anterior trunk area, the skin, muscle, and bone of the ribs, okay? So again, we said that in most areas, the anterior rami of the spinal nerves become part of a plexus, but not in the thoracic region. So this would be between T1 and T12. This is what it's going to look like. Okay, and you can see here again, we have that little posterior ramus coming around to the back, but these are the anterior rami of the thoracic spinal nerves, also called intercostal nerves. So when you guys are looking at the big spinal cord model, this gigantic thing, and I'm sorry, this is like, is this in your way? Okay. You can see here, you guys probably saw these are intercostal nerves between the ribs here, okay? So I may ask you to identify these. You can also see them on this other model that we'll be looking at in just a few minutes. Okay, questions on that? Oh, right to the first walked in, I forgot for a few seconds that it was Halloween. And I was like, is that like a rain thing? I was thinking maybe it was supposed to rain and it was like a, no. It's a Halloween thing. Okay, you look very cute. Okay, do you guys have any questions at all on this before we go on? Okay, so let's take a look at the other spinal nerves at their anterior rami, and we'll look at those plexuses. Okay, so this is a close-up of just the cervical spinal nerves. This is called the cervical plexus, and when you see this close up, you can really see how the spinal nerves kind of really unravel and reorganize themselves, forming new nerves. So this looks like a big mess. You do not have to memorize all these parts of the plexus, but I would like you to know that this plexus is primarily formed from C1 through C4, okay? So although C5 does contribute some to the plexus, so they say it is primarily C1 through C4, okay? And we are going to look at one nerve that comes out of this, and that one is shown right here. This nerve will travel all the way down from the cervical region to the diaphragm. So this is an important nerve. It is called the phrenic nerve. Phrenic is a term that actually refers to the diaphragm. We'll see there are also phrenic blood vessels that we'll be talking about. And so this is the nerve that every few seconds sends a signal to the diaphragm, causing it to contract. So obviously, very important nerve. So why do we have these plexuses? Well, if you look closely here, if you follow this up, you can kind of see how it looks like the phrenic nerve is formed from a little bit of C5, a little bit of C4, and then C3. So these three spinal nerves contribute some axons to the phrenic nerve. Now, you guys have probably heard about people who have injuries to their neck from trauma, from like sports injuries, you know, contact sports, sometimes from car accidents, very common because the neck is so vulnerable. So if there's like, say, for instance, a disc herniation that puts a lot of pressure on a spinal nerve, if the diaphragm is supplied by that one nerve and the diaphragm stops working as a result of that, it would be fatal. So this helps to ensure that body parts are having more than one spinal nerve supplying them. So it's a protective mechanism. And again, the phrenic nerve is actually made up of these three spinal nerves. Now, you do not have to memorize that this comes from C3 through C5. So this is what I'd like you to know about the cervical plexus, okay? Just this. We do have a model that shows these nerves we're going to be talking about, and that's where I'd like you to identify them. So I'll show you that in just a minute. Okay, let's go on to the next plexus. This one is the brachial, and the brachial plexus will have nerves that go out to the upper extremity. Very good. Yes, that is why it's called brachial. So notice that it is formed from these 5 spinal nerves, C5 through T1. Okay, C5 through T1. And if you go into something like physical therapy, you will have to learn all these parts of these plexuses, because as this goes through kind of the chest and shoulder area, it's an area where a lot of times people have compression on the nerves from different kinds of conditions they may have, injuries, things like that. So a lot of you know, tingling and numbness and pain and things like that down into the upper extremity from all of this area. Okay, so let's talk about these nerves that come out of this plexus. And what I would like you to know is just the general area they supply, okay? The general area. So I will tell you that. And you can see here, this is actually, you know, notice how large the parts of the plexus are. So you can see how just injuries of different kinds to the shoulder area could affect all these nerves. Okay, so this looks a lot like our model. I would want you to be able to identify the nerves on the model. You can definitely study from this diagram because it looks very much like the model. And these are the nerves that come out of it. So when I say general area, this is what I mean. Okay, so the axillary nerve comes over toward the shoulder and supplies the shoulder area. For instance, this would be the nerve that would go to the deltoid muscle, okay, for instance. But you just know it supplies the shoulder area. Musculocutaneous supplies the anterior arm, okay, meaning here. Okay, the radial nerve is a large nerve that supplies the entire posterior arm and posterior forearm. So this comes down posteriorly, so it would be like the triceps. These extensor muscles would be supplied by the radial nerve. And then together, the median and ulnar supply the anterior forearm. The median nerve is kind of right in the middle here, in the middle of what's called the carpal tunnel. So this is the nerve that's usually involved with carpal tunnel syndrome, where there's compression on the nerve due to inflammation, and so people often have numbness and tingling into the part of the hand supplied by that nerve. And then the ulnar nerve is more medial. This is the one that goes between the medial epicondyle and the olecranon process. You can feel it in here. If you kind of stick your finger in there and feel around, it kind of actually hurts when you do that because the nerve is right there, really superficial. When you hit your elbow on things, you get that kind of tingling down into the pinky. We call that the funny bone. That's actually the ulnar nerve. And so it supplies the medial part of the hand. Okay, so this is what I'd like you to know, including this right here for the brachial plexus. Okay. C5 through T1, yeah. C5 through T1. Okay, so now there are some slides in the PowerPoint that I put in here really to tell you that you do not need to know all this detail. So this stuff, although your book goes into a lot of detail with this, you do not have to know all the detail. But these are visual aids. If you're having trouble remembering what these nerves supply, you could always take a look at these pictures, and you know, it's kind of interesting, especially like I said, if you're going into physical therapy, you will have to know all these things. Okay, so it actually does a really good job of telling you all the muscles that are supplied and the parts of the skin for each of these nerves. Okay, but again, you don't have to know all of that detail. Just, you know, in case you're ever on Jeopardy. Okay, so the next plexus is down in the lumbar area. Remember, we're skipping over thoracic because there is no plexus in the thoracic region. So this is formed by actually L1 through L4. Okay, the lumbar plexus is L1 through L4. There are only two nerves that I would like you to know that come out of this. The obturator, which goes through that obturator foramen in the pelvis, and the femoral. Okay, so these both go down into the lower extremity, and I would like you to just know the general area they supply, and you can see the femoral nerve is actually a really large nerve. This is where it's kind of crossing over the groin area, going down toward the thigh. And so here you can see the obturator nerve traveling through the obturator foramen. It's going medially. So this nerve supplies the medial thigh. And the femoral nerve here is actually, again, it's pretty large, and you can see it kind of branches out, and its branches supply the anterior thigh. This would be the nerve that supplies the quadriceps muscles. Okay, so femoral is more anterior, the obturator medial. Okay, and one more plexus, which is the sacral. Okay, so again, this is just for fun. You don't have to know this much detail. Okay, so the sacral plexus is formed from L4 through S4. Okay, L4 through S4. So L4 contributes to both the lumbar and the sacral plexuses. Okay, so there is one gigantic nerve I would like you to know that comes out of this plexus. It is actually the largest nerve in the body. It is called the sciatic nerve. Okay, sciatic. So that C is silent. And you may have heard of the term sciatica, which is pain along the nerve. This is a nerve that's really large, so as it travels through, especially like the gluteal muscles, sometimes it's compressed in there. It also is affected by sometimes when people have disc herniations in the low back area, the lumbar region, can put pressure on the nerve roots that form the sciatic nerve. So people often have, it's very common to have pain along the path of the sciatic nerve. The sciatic nerve really is formed from these two nerves, but they're wrapped up in connective tissue until they get to right above the knee, and then they'll split. And these are called the common fibular or common peroneal and the tibial. So I would like you to know those two parts of the sciatic nerve. Okay, and this is about a 1/2 inch in diameter. You can see as it's traveling through here, this is kind of the gluteal area. You can see how large it is. So you can see how these muscles would maybe compress it. This is the piriformis muscle, and this is a common area for the nerve to be compressed. There's something called piriformis syndrome, which can cause sciatica. And also, if you're going into nursing, this is an important nerve to know about. You'll have to know exactly its pathway, because when you inject a patient in the gluteal muscles for an intramuscular, injection, you don't want to inject the sciatic nerve. So you'll learn how to, hopefully miss that nerve when you give an injection there. You can go toward this upper outer part of the gluteal region. Okay, so you can see here where the common fibula is going to branch off and travel toward the fibula, it goes laterally, and the rest of this is the tibial and its branches. So I'd like you to know those two parts of the sciatic nerve. So what does this supply? It actually supplies the entire leg. Do I have that up here? Maybe not. I don't know. Okay, I guess not. So it supplies the entire leg, lower leg, and the posterior thigh. And so when people have sciatic nerve pain, it's usually in the posterior thigh and sometimes down into the leg. Okay, so you guys will be identifying these on this model, and actually, like I said, it really looks like the diagrams. So I think you can, use the diagrams along with this and figure them out pretty well. Okay, you can see all of them, including the Prina. Okay, so I may ask you to identify like a plexus. You can see this whole thing here is the brachial plexus, and I'd also ask you to identify the individual nerves. And you can see also the intercostal nerves on this model. So this would be the lumbar plexus, sacral plexus. I'm not going to have you identify parts of the spinal cord here because, it's too hard to see all that detail of the spinal cord on this. Okay, any questions on any of that? Okay. Okay, so I'll tell you what, there's a few slides here on reflexes. And we've talked a little bit about reflexes. You guys know that a reflex is a quick response to some kind of sensory stimulus. So this is the definition of a reflex. Okay, short neuronal circuit just means that there's fewer synapses. So that gives us a quicker reaction time. And these are different functions of our reflexes, right? They may be protective as far as, you touch something hot, you pull your hand away, protecting us from tissue damage. They might maintain homeostasis, like the reflexes in the medulla that maintain heart rate and blood pressure. Okay, we do have reflexes called stretch reflexes in our muscles. And an example of that is like when the doctor taps your tendon here and you have the reflex contraction, that actually is a reflex that's in the muscle. So when the muscle's stretched, we have a reflex contraction. And so those reflexes, what they do is they help to constantly kind of sense the tension or the stress or the stretch, stretch in the muscle. So they kind of keep adjusting the amount of contraction in the muscle. And this kind of helps us to not only, it helps to maintain posture and keep us upright, but it also keeps the muscle at an optimal length for contraction. You guys remember that in the sarcomeres, the myofilaments have to overlap some. If we get the muscle too stretched out, it's not going to be able to contract with any kind of, force. And if they're too much overlap, the same thing happens. We can't really generate a strong contraction. So that type of reflex helps to keep the muscle at an optimal length. So the reflexes have different functions. They can involve just one synapse or more than one synapse. Okay, so this is an example of a reflex that helps protect us from tissue damage. Okay, so pain receptors respond to like a pin in the skin. That information comes in on a sensory neuron. Notice there is a synapse, an extra neuron here in the spinal cord, a little interneuron that connects that sensory neuron to a motor neuron. And the motor neurons will go out to our muscles that would pull the body part away from that painful stimulus. So this is called a withdrawal reflex, okay, because we withdraw the body part from the painful stimulus. Withdrawal reflex, okay, is what this is. And then I think we also have a picture of a stretch reflex. And we'll come back to that. So this is, again, the same thing. This is the painful stimulus here, so this is a withdrawal reflex. And this is an example of the stretch reflex within the muscle, okay? That here we have the reflex hammer hitting this tendon, which stretches the muscle, and so we have a sensory stimulus on the sensory neuron. Notice here there's no interneuron. So here the sensory neuron synapses directly on motor neurons that go to those same muscles, causing a reflex contraction. Okay, so that's why your leg kicks out. And so this helps to maintain the optimal length in the muscle. Okay, now in real life, we don't constantly have that, strong of a contraction. This is kind of an unusual case. This is just to test the reflex. So these reflexes work, much more subtly to kind of maintain optimal length in our muscles. Notice though that because we don't have an extra interneuron here, this is going to be a quicker reflex. This is the shortest reflex arc in the body, okay, because there are just two neurons involved. So because this is kind of a complete circuit going from the sensory receptor here in the muscle back to the muscle, same thing here, it forms a complete circuit. These are called reflex arcs. Okay, and these are the 5 parts of a reflex arc. If you think about this, this makes sense. We have to have a sensory receptor that sends the information to a sensory neuron. Okay, the integration center is just where the sensory and motor neurons meet. This would be somewhere in the central nervous system, spinal cord, or the brain. Okay, and then we have to have a motor neuron that sends the response, right? Whether we get a contraction of a muscle or secretion of a gland, okay? And the gland or muscle is called the effector. So I didn't want to spend much time on this since we still have to talk about the autonomic nervous system, so this would be extra credit. If there's any questions on the reflexes, and honestly, I do not remember if there are. I think there may be 1 or 2 on the written exam. So you can read over this if you feel like doing that. It's extra credit. It will not hurt your grade if you don't take time to go through that. But I've already covered it, so you can see how long it took. Okay? So if you just read through this a couple times, or again, if you don't want to, you don't have to. Okay? Now that does not include reflexes that we've already talked about. The reflexes in the medulla and the visual and auditory reflexes in the superior and inferior colliculi, we've already talked about those. Okay, so those are not extra credit, just this. You guys have any questions? Okay, so let's talk about the autonomic nervous system.